What's up everybody, Dr. Rossi, shrinksandsneakers.com. So in this video, what I'm going to do is cover a little known topic that is not as common in clinical practice as the books may sometimes lead you to believe. And that is the topic of body dysmorphic disorder. So what is body dysmorphic disorder? Body dysmorphic disorder is where the patient will have an excessive preoccupation with a perceived defect that is only minimally noticeable to other people, or in some cases, not noticeable at all. So the person perceives something, let's say it's a defect in their nose, and they believe that it looks completely ridiculous and terrible, and that everybody can see it, and that those people that are seeing it are not actually choosing to tell them about it. They're just sort of being nice and humoring them in these cases. So that's essentially the basis of body dysmorphic. Okay, so more about what a person with body dysmorphic disorder might be doing, right? So this person is going to engage in excessive, repetitive behaviors or mental acts associated with this perceived defect. So they're going to try to do things like repetitively checking themselves in the mirror to make sure, hey, does my nose look okay? Is it shaped correctly? Does it look right on my face? What's going on? They're going to continue to look at those things. So things like excessive viewing of themselves in the mirror, constantly checking. They would also do other things like possibly continuing to groom. So for instance, somebody who thinks, oh, my hair doesn't look right, they have to continue to change it, cut it, alter it in some way, because it just doesn't ever seem to look correct. And again, people around them are noticing the defect, or at least this is what's going on in the patient's mind. People around them are noticing this defect, but they're just being nice and humoring them and not necessarily pointing it out. These people also tend to compare their appearance to other people. So they're going to be constantly looking at their appearance and then comparing it to anybody. Could be friends, family, could be celebrities, could be things in social media, TV, etc. So they'll be comparing as well. So these repetitive behaviors or mental acts, such as checking in the mirror, grooming in a certain way, and also, again, comparing their features to that of others. So you might be thinking to yourself, Dr. Rossi, well, people should be concerned about their appearance to some degree, right? It's healthy for us to say, well, I want to make sure that I'm clean, that I appear in a certain way, that I'm keeping, say, in my field, a professional look. Okay, fair enough. That's a reasonable thing to think about. But again, these patients, it's excessive, right? It's to the point of excess, and the behaviors are excessive as well. A great example of this that's very common and probably more of a problem than people even understand is in the world of things like bodybuilding or fitness modeling or something like that, where there's constant need and pressure to be bigger, to look better, to have lower body fat percentage, right? So it's a constant comparison to other people, and in some cases this can be excessive. It's good to be healthy, it's good to work out, it's good to have a certain degree of muscle mass and size on your body, of course, all these things natural. But again, the difference between anything that becomes a disorder versus something that's just a normal behavior is always the degree of impaired function. So the person that has body dysmorphic disorder is spending a large amount of time doing these things like checking in the mirror or training, say in the case of people who are trying to achieve maybe ideal body health. So the final point I want to make is that, again, this disorder, although we recognize it and we're aware of it, we understand it, we read about it, we learn about it, in clinical practice, I'll say that this rarely is something that a person's going to present with. And again, it would be rarely something that someone would present to, say, an emergency setting and or an inpatient unit with, because they would likely be there for another reason. So it may be the case that this person's body dysmorphic disorder is so concerning that it's led to a depression, and then that depression leads to a suicide attempt, and boom, they land in the hospital. So the primary issue might be the body dysmorphic disorder, but again, they'll likely present for another reason, something like, say, depression, suicidal ideation, etc. So it's very uncommon in practice. And most people don't really recognize it, again, as much of an issue, even though it may be. And so I'll give the example of body dysmorphic disorder with muscle dysmorphia. So this is sort of a specifier associated with body dysmorphic disorder. And these individuals will typically be male, right? Men tend to be more concerned about muscle size than women. And the person will be preoccupied with the idea that their body is too small or insufficiently muscular. So this is where I got this concept or example in the previous clip discussing how, things like bodybuilding or fitness modeling in the industry could lead to this disorder potentially, but again, it will likely go unreported and of course untreated. So that concludes the brief discussion on body dysmorphic disorder. If you have other questions, please comment in the comment section below, and like and subscribe to the channel. It helps us to keep pumping out videos.